Good morning, good afternoon, good evening, ladies and gentlemen. Thank you for joining us from Geneva this time for the launch of the Plan to Impact report number 5. It is my utmost pleasure to welcome you all. And as you know, a lot of you will be logging in and going online now. I have the pleasure to introduce you to my fellow panelists before we get into the discussion, which is going to be fast as usual. So to my left, I have Dr. Tarun Dua of the WHO. Dr. Tarun Dua will be familiar to all of you. She has been one of the main creators of the Global Dementia Action Plan at the WHO, and we've worked together for many, many years. It's a joy to be together in the same room. I have to say, it's been a long time since we've been able to do this. We also have Dr. Teresa Tam, Chief Public Health Officer of Canada. You will notice that there is an alphabetical sense to the way that I'm going around introducing speakers. We are missing the representative for Indonesia. We hopefully will join us soon. We then have Dr. Shah Mahir, who is the Minister of State for Health of the Maldives. Dr. Etienne Abela, the Minister of Healthy Aging in Malta. We are all extremely envious that Malta has actually a Minister for Healthy Aging. We are missing Minister Vidot of the Seychelles. Hopefully she'll join us later. And then we are joined by Irina Shevchenko from Nebuzhny Dementia Association, our member association in Ukraine. And last but not least, Birgitta Martensen, the former CEO of Alzheimer Switzerland and a former board member of Alzheimer's Disease International, who also is today representing people living with Alzheimer's disease. So I welcome you all to this important event. And without further ado, I'll go and do the presentation because we have a lot to go through this afternoon. So if I could have my first slide. So for those of you that have been following us, this is the fifth time that we publish Plan to Impact. It's an important report for us because we essentially monitor what is going in the Global Dementia Observatory, and we interrogate our members around the world about whether they feel that those priorities are the same priorities that they see happening on the ground, and most importantly, whether they see any practical action happening on the ground. So if we could go to the next slide. So very briefly, this is the situation. In red are the countries that have a plan. In pink are the country where there is nothing. In gray, hopefully this year you can see that there is quite a lot of countries in gray. There are 21 countries at the moment that are considering a plan. What's really interesting this year about the plan is that we haven't seen any plan or strategy approved in this year, but we've seen a lot of countries making a lot of progress on the plan. And we have launched a campaign to work with individual governments to help them make the plans for a strategy or plan concrete. And if you're hearing us from a country, hopefully this example will inspire you. Next slide, please. So this pie chart shows you which are the how many national plan adopted, 36, how many dementia strategies integrated into other policies area, 3, how many in development, and unfortunately still a lot of countries with no plan. So this is what we are trying to get. More gray, less red. Next slide, please. And this is the amount of plans we should develop every year to get to the targets of the Global Dementia Action Plan. So as you can see, still a lot of work to do to see more plans adopted. Next slide, please. So with this, I am concluding our presentation of a report which is actually many pages long. And that I hope that many of you will be having the time to download. I also need to do a couple of technical calls before we pass to the rest of the panel. And that is, if you're following us online, please remember to write your question in the chat. A couple of countries have asked us to make intervention from the online floor, and I will pass on over to you after the presentation on the panel. If there is any country wanting to make an intervention, please prepare your questions. I'll ask countries to go first, and then everybody in the room also will be able to ask for questions. And without further ado, I hand over the microphone and the floor to Dr. Tarun Dua of the WHO.
Thank you, Paula, and it's a pleasure. Do you want me to stand up or keep?
You can stay there.
It's kind of adjusting, to the next face-to-face meetings. I would have been sitting on my desk and chair and not asking this question. So we are getting used to doing it the other way. But truly, it is wonderful to see, to have this meeting in person, to see you, Paula, and see others, and it is really a pleasure. And I would say that coming from the Department of Mental Health and Substance Use, personal contact is so important for our mental health and well-being, and a lesson that we have learned during COVID-19, especially for people living with dementia and their families. So it's this opportunity with your report, there's a lot to discuss. As we know that we are 5 years into the implementation of the action plan on dementia, and I should say lots have been done, but lots and lots needs to be still done and need to be done together. We are short of achieving our 2025 targets, as was demonstrated in the global status report that we launched last year, and that what you are also describing through your plan to impact report. And this is much more for low and middle income countries across the world than for many of the high income countries. So I really congratulate ADI, Paula, you and your team on this accountability mechanism that you have established for this report. And I see this as an opportunity to urge, reinforce that we need action both globally, regionally, as well as at national level to fulfill the vision of the action plan. I thank everybody who's here on behalf of the different countries, different groups in addressing this challenge. You're well aware about all the different technical tools, and if I'm not mistaken, my colleagues have this slide up to show all the different tools that are available from WHO. But that's one step. The next step is how do we take this forward? There have been even during COVID-19, work continued. We continued working virtually. We learned new ways of working together, and we had various capacity building workshops. For example, in last 6 months, 46 countries covering 4 regions came together. The latest being the workshop that was organized by the Ministry of Public Health Qatar, and I thank them that were able to bring together 17 countries to learn from each other. And this was actually beginning of this month, so that's really great. You are also aware of our Global Dementia Observatory Knowledge Exchange platform, the data platform that you have been using, and the need to share experiences. And I'm so much looking forward, Irina, to hear about the incredible work that you have been doing. It's a real pleasure to have you here today. One of the areas of work that I'm very proud of personally is, and this is because when this was even before the action plan, when we started thinking about work in dementia and what should be the first product from WHO, it was iSupport. And it was that, okay, we need a product reaching out for people, the caregivers of living with dementia. And truly with the COVID-19, the discontinuation of services have told us that we need more and more online tools. We need more and more accessible training and support mechanisms. Proud to say that it is being implemented in many countries, 36 countries, available in 31 languages. And special thanks to government of Malta for implementing it at national level, so becoming the first member state to make that happen. Let me end with saying that all of these activities, especially in low and middle income countries, where the action is most urgently needed, we need to work together. We need to work together as one community. We need to coordinate all our implementation actions, all our research efforts. We have the tools, we have the knowledge at our disposal. And together, I feel we can make this world a better place for people with dementia and their families. Thanks, Paola, once again.
Thank you so much, Tarun. And indeed, there's been a huge amount of work. And I think the progress that we are seeing, again, this more organic progress, I would say, not big announcement, but a lot of stuff happening moving forward, is a lot, the product of a lot of people working together. And now it's my pleasure to pass the mic to, actually you're mic'd up, so I can keep my roving mic, to Dr. Tam from Canada, and public health in particular. And so we're very keen to hear more about Canada's plan and Canada's projects going forward. Thank you so much.
Thank you very much. And is the mic working? That's great. Step number one. So it's really amazing to be here. And as everyone was saying, to be able to connect, which is very important for mental health, but also for persons living with dementia, that connection. And that's what we've been craving for the last 2+ years. I think I just want to thank the Alzheimer's Disease International for organizing this event, just to keep the momentum going and holding all of us accountable, actually, in terms of progress in this area. And the WHO, of course, for your work on the Global Action Plan. So I think this is a really incredible opportunity to just exchange some learnings of how we've gone about developing our own plans and strategies. So Canada developed its first national dementia strategy in 2019. It was released June 2019, so about 6 months or so before the start of the pandemic. And some of the activities that I would describe we've been doing underneath our plan is going to sound very familiar, because we intentionally aligned it to the WHO Global Action Plan in terms of at least the framework. And I think this was an important step, because everyone in Canada knows someone with dementia, their loved ones, their families, the patients and the populations that we serve as in public health. And about 6.7% of our population, 65 years of age or older, have been diagnosed with dementia. And that's a lot of Canadians, and 2/3 are women. So you have to take a gender lens to our plan, and including LGBTQ2+ communities. And I think our incidence actually went down, but I think the prevalence and number of people living with dementia is continuing to go up. And we have 3 national objectives. That's to prevent dementia, to advance therapies and cures, and to improve the quality of life for people living with dementia and their caregivers. And there is no one size fits all, really, in terms of the actions that we need to have happen. We need to develop more tailored approaches to different groups and their needs, different social cultural contexts, and there's certainly different groups that have a higher risk of developing dementia. But there's also a major health equity issue. Many Canadians, many people living in Canada experience quite a lot of barriers to services, social services, and healthcare. So I think some of the key actions, one is increase awareness and reduce stigma, which is still very prevalent. And some of it's just due to a lack of awareness and education in the general public. People don't know how to approach or interact with someone with dementia, for example. So we launched a very broad national public education campaign early this year with multimedia approaches, television ads. That's a very broad reach, and that's not enough. So we have some very targeted awareness raising activities and projects where we can supplement the broad range awareness activities to more tailored approaches. For example, to have dementia inclusive communities in rural areas. That's quite specific. And for people who have certain language barriers and different cultural backgrounds, and intergenerational activities, which is very important. And then other projects are more focused on prevention and increasing awareness and learning about healthier behaviors and learning about the risk factors, and developing such tools on mobile apps and outreach to different ethnic cultural communities. And second area is guidance, which I actually think is quite aligned with the WHO guidance. I'm sure we leverage a lot of those tools, but developed it in some very specific ones to our Canadian context, which includes Indigenous-led guidance as well. It's very important for First Nations, Inuit and Métis communities to have self-determination and adapt what they need for their communities in terms of dementia. And we've been through a pandemic, so some of our guidance is looking at times of emergencies and also natural disasters. There's climate change. There was a lot of natural disasters that severely impacted people with dementia. I think, and a lot of community-based projects. So I think public health really is local, and it should start with community-based participatory approaches. We developed advanced care planning activities, as well as some projects really focus on stress and burnout among caregivers and building relationships with people living with dementia, their families and friends. And so I think some of these, we can very much learn from other countries. Rural Francophone minority populations needed some more tailored approaches as well. Some of our other areas are really building up the data and looking at different ways of collecting and analyzing data, looking at risks, factors, disaggregated information, comorbidities, dementia in long-term care settings as well. COVID-19 has a devastating impact on long-term care, which included many people with dementia. And we also needed to look at indigeneity and race in terms of the data. And in order to better serve the community, we also looked at micro-simulation models to look at the impact of dementias and their associated economic and healthcare costs as well, and conducted public opinion research so that we have a better understanding of how we can do better in increasing knowledge and reducing stigma and encouraging people to take action. And finally, we've spent quite a bit of focus on investing in dementia research. I'm sure nobody thinks it's enough, but you got to start from somewhere. And I think dementia in the brain and addressing the mental health consequences. So I think we're in the early stages, but some of our initial findings are quite interesting. Some of it looks at how we incorporate cultural traditions and experiencing positive memories for persons living with dementia, and also creating safe spaces for LGBTQ2+ communities. So maybe I'll just end there by saying that it takes a massive amount of collaboration involving many people, including people living with dementia, in order to get this far. And I'm hopeful, even though there may be some setbacks, that we can reinvigorate our collective action in reducing the impact of dementia as a public health issue.
Dr. Tam, thank you so much. You've gone a little bit over time, but I did let you speak because I was fascinated. And I thank you very much for mentioning so many important things in public health messaging, but also the courage of Canada of publishing the data around how many people with dementia did unfortunately die of COVID-19. Possibly the country that has collected best that data, that then has informed a lot of our advocacy around this. But also for mentioning some interesting community on which you have worked much more than other countries. So it's been a great thing to hear you speak. I hope from the audience there will be a lot of questions. Now, it is my very great pleasure to introduce the Minister of Health of the Maldives, who is going to tell us a bit about a country which has come later to this particular issue. Our member is one of our youngest member, but is doing a lot, and there is a lot of awareness. So please, the floor is yours.
Thank you very much, Paola. Representative of Alzheimer's Disease International, honorable ministers, WHO representatives, delegates, all participants. Good evening to you all. It is my pleasure to be here with you all, and thanks for inviting me. ADI's team has been very kind to me. I'm pleased to be here in this very important discussion that we're having today. And it is affecting so many people around the world. Millions of people are affected. The condition we're talking about today creeps in. The onset is very gradual and insidious. It takes away the personality, it takes away the memory, it takes away the confidence in those people who are affected. The capacity to communicate is lost. And the most important thing that we all value as human beings, it loses the person's independence. Dementia is rapidly becoming a global epidemic. We must do more, and the world must do more, and together I'm sure we can do much more. As you all know, dementia is the 7th leading cause of global deaths in the world, and this is the foremost cause of disability and dependency in older people. Finding an adequate solution is the issue that the world must find a solution, and it's a global health priority. I want to tell you a little bit about this in Maldives context. As Paola has said, we are a new member and we want to do better and recognize the work that we need to do for dementia. Maldives is a very small nation. We have 1,200 islands dispersed in the Indian Ocean. We are approximately, excuse me, 800 kilometers, and 188 islands are inhabited. So delivering healthcare in this geographically dispersed island is very difficult. And we have people as few as 200 people living in one island and thousands of people living in other islands. So having delivery of care is a challenge, and transportation is very difficult and very expensive. We have a population of 500,000 people, and 1/3 of this population lives in the capital city, Male. And when we look at the health care workforce, it's very mobile. So 70% of our healthcare workers are from neighboring countries. So retaining them, training them is a challenge that we have. Therefore, with all these problems, equitable access to healthcare is a challenge for us. So we have a health scheme that covers, insurance scheme that covers all Maldivians. So it's free service, but accessibility is an important thing. The last 15 to 20 years, we've had, our focus has been on curative, not preventative. So we haven't invested much. And now the focus is really to invest on the primary healthcare. So the government is doing its best to do that. During the pandemic, it really hit us home, the problems we have in the community. The vulnerable population, the access to care is a problem. And really we recognize that we really must have a mechanism to reach these people. And that includes dementia as well. Our research, our projection shows by 2054, the older person's population will be 14%, and Maldives will be considered an aging society. Therefore, the government is committed doing some concrete measures now and address this issue straight away. The strategic action plans, the Maldives 2019 and 2023, and National Recovery and Resilience Plan has priorities to formulate new mechanisms and provide decentralized services for most vulnerable people in the Maldives. So although now it's 4% of our population is the elderly, but we mustn't leave anyone behind. So we want to address that 4% and we want to develop a dementia plan. So when we have already started a number of work with our local Alzheimer's Society, Maldives, and the society is in touch with ADI, and currently they're in the enrollment process, and a lot of campaign is going to be planned this year to create awareness in the Maldives. So we also wish to hold a stakeholder meetings, and we would welcome WHO and ADI's support in that, getting technical expertise for us to develop this area. So just to conclude, we are very committed, government is very committed to looking into these issues and having a dementia master plan for Maldives. And we hope to work with ADI and WHO for this. And I thank you for listening.
Thank you so much, Dr. Shah. I mean, it's so wonderful to see a country that is a young country that is looking in the long run about what is going to happen, and it's going to happen to everybody, whether we want it or not. So it's so good to have plans set in place. And now, can I introduce you to Dr. Etienne Abela from Malta, the Minister of Active Aging. So tell us what you've been doing in Malta. You're always up with some new wonderful idea. Thank you so much.
Thank you, Paola. Thank you. Thank you, and thank you for the invitation. I wish to thank Alzheimer's Disease International and the World Health Organization for collaborating and organizing this event. Malta, like Maldives, has got a population in the region of 500,000. However, we consist of 2 small islands. So our islands are very densely populated. We have a very dense sunlight as well, like here today. And we're dense in history. As Paul is saying, our government has created a new ministry for active aging that is now a couple of years old. I've been in post for the past 2 months. So most of what I say here is due to the hard work of my predecessors. I'm a pancreatic surgeon by trade, so I will delineate the achievements that my predecessors have made over the past years. As Paula said, Malta has long committed itself in making dementia a top health and social care priority. We owe this to the ever-increasing number of individuals with dementia and an even higher number of caregivers. In 2015, we launched our National Dementia Strategy, and this encompasses a strong commitment from all stakeholders in order to empower change and make a true difference in the lives of these individuals. To this effect, Malta was the first country to have a dementia-friendly version of its strategy document. This forms part of our vision towards a rights-based approach to dementia. A fundamental aspect of our work is that of increasing awareness and understanding with the aim of reducing the stigma and misconceptions about dementia. People need the right information and guidance in order to recognize the early symptoms and seek the necessary support. With this aim in mind, we published and disseminated a number of information booklets, including a booklet for school children and an easy-to-read version with the objectives of, number 1, changing the negative perception of dementia. Number 2, to encourage help seeking. And number 3, to make a timely diagnosis. And most importantly, to provide the guidance on the availability of support services. Information and awareness are key. So sessions have been set up at local community level, with one initiative using street theatre as a means of reaching the general public. In 2019, a national conference on dementia was organized at the Maltese Parliament itself, where policymakers, experts, representatives of civil society came together to discuss current and future dementia policy. Each year, we also hold the Dementia Awareness National Awards that recognize the altruistic gestures, the dedication, and the sacrifices by individuals, professionals, family members, and organizations who care for people with this condition. We embarked on a nationwide dementia training program to develop and enable multidisciplinary force to ensure the provision of high-quality dementia care. Malta, in fact, was the first country to introduce a customized version of iSupport, an online training program for informal caregivers. This was developed by the World Health Organization. We have also invested in assistive technology, and we are gradually transforming our care homes to become dementia-friendly, in conformity with the recent enactment of the social regulatory standards for residential services for persons living with dementia regulations. Recently, we have also opened a number of dementia day and night activity centers. Dementia goes beyond our shores. No single nation can tackle this on its own. It is thus through a collaborative and coordinated global effort that we can successfully face this challenge and effect change. To this effect, Malta has been at the forefront of working with our international partners to make dementia a policy priority. In September of 2019, we hosted a WHO European and Eastern Mediterranean region workshop, which, with a number of national experts from 11 countries, was a success. Such exchanges are vital to build understanding and provide inspiration. We need to accelerate our effort towards making dementia a health priority. For good reason, one of the main objectives and actions areas of WHO's Global Action Plan on the public health response to dementia. Furthermore, the continuous benchmarking of national dementia policies and strategies will help countries to learn from good practice, learn from one another, and engage more effectively. It will be a constant reminder to policymakers to try to lead and innovate. Malta invites representatives of the WHO, international organizations, and countries to continue asking for dementia to be a priority and on the agendas of relevant high-level forums and meetings of national and international leaders and bodies. Our presence here is a statement of our commitment to this. I sincerely hope that this event will continue to add momentum to our collective effort of making dementia a truly global priority. Thank you.
Thank you, Minister Abela. What wonderful words, and coming from so much action, can I say, because Malta is doing a lot of action, and we cannot thank you enough for everything that you are doing and being an example, not only on the national stage as a country, but also on the international stage. Now, just to remind everybody that is following us online that if you want to ask a question to the panel, or in general, please do write your question in the Q&A. Chris Lynch is there with us in the room and monitoring those questions, and will be able to share them with everybody. Now, can I please ask Irina Shevchenko, who is the founder director of Nebutny in Ukraine, our member on the development membership of ADI, who has found herself very much at the center of our membership. So Irina, your story, please. Thank you.
Paola, thank you, ADI team, for inviting me here today. So as Paola told, I'm a founder of the Nezabutny Foundation, a charitable foundation in Ukraine, which is the translation from Ukrainian is unforgettable. I founded this organization because my family faced dementia. And at that time, I started to search what exists in Ukraine, what support we can get from the government, from other organizations. And I was sadly disappointed, unfortunately. And I made the decision to work in that area. Our organization is young, so we started in the beginning of last year. During the previous year, we made the foundation of all our programs, and we worked on the building the dementia-friendly society. And by the end of the year, we realized that however hard we try, we cannot change the system as a whole without cooperating with the officials, with the ministries and the government. So with the guidance of the ADI, we started sending emails, letters to our ministries. At that time, that was probably November 2021, I felt like a real big, long distance between our organization and the ministries. And then the war happened on the 24th of February. And it changed completely everything. All the programs that we had, we stopped and we started to react on what was needed the most. The pharmacies were closed, so our volunteers searched for the medications throughout the country and provided them to people who needed them. Then, thanks to WHO, to ADI, we found partners worldwide and we brought a lot of medications to Ukraine. Thank you very much for that. We launched the online website, which is called Nezabutny United, where we provided a lot of online support, psychological support for relatives, then medical consultations for the people who cannot leave their places. And it was maybe 1 month after the war started that I realized that we are working, shoulder to shoulder with our ministries, both with the Ministry of Health and with the Ministry of Social Policy. And the distance was zero. So we were exchanging calls with the top officials on the regional level, on the government level, and this is still going like that. And at one moment, I just thought that if we had our national dementia plan before the war, if we had all these connections that we have now, all this cooperation, mutual cooperation, it could be much more effective now, everything that we do. I truly believe that the National Dementia Plan is something not theoretical, it's something really practical. It is something that can help the third sector really to feel the support and to work closely with the government as one, as one team. So we will definitely work on that. Thank you very much for opening this for us, because before I didn't even know about that. I just had it in my dreams. And just one more thing I would like to say, thank you to all the countries that support Ukraine for now. Please continue supporting Ukraine. Please do not take the war for granted. If anybody wants to help people with dementia, please reach me or any other organization or the government in Ukraine. And please help people who fled from Ukraine, people with dementia who are in your countries. Please provide them with at least information, maybe some care and medical support. And I truly believe that we together, united, we can really fight those two big challenges that we have now. It's the war in Europe in the 21st century, and the second one is dementia. Thank you very much.
Thank you so much for your intervention that comes from the heart. You've been incredible throughout all this crisis from day one, and we have been inspired, but also ADI is born out of solidarity. This is why we exist. And so to have this practical demonstration has been fantastic. And also the crisis in Ukraine has heightened some other issues for us that we will have to tackle going forward. They're not for this webinar, but there is so much else that this has really made us more aware of. Now, last but not least, I am going to hand over the floor to the wonderful Birgitta Martensen, a former member of the board of ADI, the former chief executive officer of Alzheimer Switzerland, a personal friend, and now someone who has been diagnosed. So, Birgitta, the floor is yours.
Thank you. It's very nice to be here and be talking to all of you. Am I really a person with dementia? I imagine that you wonder, is it really possible that that person has dementia? Yes, it is. But I will start with the work that has been done that I find so fantastic, that the idea of having Alzheimer plans has been introduced in a lot of countries. And that's great. We didn't even dare imagine that it could be possible. And I was fighting for that in Switzerland when I was working in the Swiss Alzheimer Association. And it was very hard before we got to be able to talk to them, to even make them understand what are we talking about. And that time I didn't have dementia. But we managed. And that has happened in quite a lot of countries. And that's fantastic. And it's not very complicated. You don't have to imagine something new, because dementia is dementia is dementia. What you have as possibilities to help these people will be different in different countries. That's for sure. Now, having a plan doesn't mean that it changes. You have to imagine the measures to be done to get things happening. It's nice to have the paper, but if you don't start it to do practical activities to make people being able to attend these, to get to have these this help and understanding, you can have the papers, but you don't have the act. So I think it's extremely important in every country to keep the actors and the public informed, clearly informed what has happened with our plan. Where are we now? Has anything happened at all? Because that makes it go forward. When people feel, or authorities feel, someone is watching us. It's not just taking out the paper, look at we have signed it. That's not enough. A signature is nice, but that doesn't give us any help. So, and I think we have to have the regular controls of everything that has been introduced for these people. It's not something that you can sit down and say, well, we did it. No, it has to be followed and it has to be improved. And you have to involve people who live with dementia. I'm not talking only about the people who have dementia, but of course also the people around them. You concentrate, I know, and I did it as well, on the people around the persons who have dementia. I think you should introduce a bit more attention to the people with dementia, because we can do a lot. When we have diagnosis early enough, we can do a lot to explain whatever we want and how it should be done. And we are not things that you place around in your country. You can go into that care home or so on. I want to live at home. That's where I'm living home. I have no help. I manage my own life. And I have had dementia. The first time I realized it is 7 years ago. But I only had a final diagnosis thanks to a lumbar puncture in this year. So, and the more capacity you have, the longer people don't believe you when you say, I know that I have the trouble. So don't forget also these high level people, high level, I mean, with a high level of cerebral activity. They also have dementia, and they can help to develop what we really need to inform, to help, and to understand what's happening. And then that would bring down the job that has to be done by other people. So if you want to know more about my personal experience, I will be happy to answer your questions if you dare talk to me. But I don't bite, right? No, I don't bite.
You definitely don't bite.
Thank you very much for daring invite me here. Because normally a person with dementia, no. Thank you.
Now, we are now thanking Birgitta for a fantastic and spirited intervention and for having the courage also to come and speak on this panel, which is always a little bit of a daunting thing anyway. We are now going to open to the floor more widely. And we have a first question, but before I take the question that is online, can I ask anyone in the audience and give you priority if anybody has a question? Yes, we have a lot of hands. So can I ask the representative from Sri Lanka, please, to ask his question?
I'm Kausha from Sri Lanka, and thank you for very comprehensive panel. And it's amazing because I know how affected the family dementia because I have personal experience with my grandma. Anyway, and thank you for Canada. You bring gender perspective, LGBTQ community, as well as Maldives, our neighbor country. Anyway, in Sri Lanka, we don't have a dementia national action plan. So I saw a lot of countries in the report, they don't have a national action plan. How we can bring those countries to this national action plan? How we can bring them to the on board? That is my question. That's a simple question. Yeah.
So how to do a national action plan? Now, the question was for the representative from Canada. Yes, Dr. Tam, what did you think? There was a lot that happened in Canada to get to a strategy. You got yours, yeah.
Well, I think as with all of these really important initiatives, there's always a grassroots advocacy that takes place by societies like the Alzheimer's Disease International and our Canadian counterpart. So that's always really important because to get political commitment, it's not just the public service and the people in public health trying to advocate for this to be done. From the public health perspective, and what the Public Health Agency would do is to provide data, on what's happening in Canada as much as we can, because that shines a light on the actual impacts within the communities. And then it's really a very collaborative process. And we did engage very highly functioning people living with dementia who have plenty to say, some of whom are actually younger. They're not all older people either. And there are many voices and they're caregivers. And so I think with all of that momentum, there was then the political commitment and process. So there was an act of Parliament, which was called the National Strategy for Alzheimer's Disease and Other Dementias Act. And we have to report to Parliament every year. So that holds us accountable in terms of progress. So, but in the end, I described some of the activities, but it's through this massive degree of collaboration. It's never easy, but I think you got to take one step forwards and then keep building on it, I think.
Thank you so much, Dr. Tam. The Alzheimer's Society of Canada, also who is not with us in the room, has been advocating for years. It's a complex situation there, not as complex as the one you have in Sri Lanka, but Canada is a federated country. And so as ever, also there are different federal priorities and they go to the government and there is a central government and a federal government. A lot of our members, it's like that, Mexico, Brazil, Argentina even, and of course the States. So there is sometimes then the need to understand the local, the very local and the national policies. But of course, we are here to help also because we see so many of these examples. I know we got a lot of questions, but I wanted to ask the same question to Minister Abela because you've gone through a lot of this.
Going through the planning of a national strategy for Malta is obviously much more easy than for Sri Lanka or Canada because of our size. We're small, we have a centralized system, everywhere in Malta is very close. So for us, it was easy. You can use us as your models, but I'm not quite sure how this will work in a large country which has a federal system. The dementia strategy, we planned it over a 9-year period, starting in 2015, and the plan will finish next year, actually, in 2023. It's very important to pick the salient priorities of that plan. And as we've been saying, as Peggy said, you need timelines, I think. You need timelines. And, you know, then it is the politician's job to make sure that everybody sticks to those timelines. For example, we had 77 recommendations in our plan with 1 year to go, and with the stunting that we suffered from 2 years of COVID, we performed well on 70% of those 77 recommendations. It's doable.
Thank you so much. Now I'll have to keep our panelists to a very short answer because we got a lot of questions. Now, Tarun and Minister Shah, now the next one is for you. So this comes from the Seychelles, who obviously wanted to hear from their own minister who hasn't showed up. We'll pick them up about that later. But the question is very interesting because how can this Seychelles make Alzheimer's a public health priority? And I thought how they're asking how WHO could help, how ADI could help, but Tarun, I'll ask the question to you. But also, given that we have the minister of another small nation, the coda of this question is how can we do this knowing that we are going through economic crisis at the moment post-COVID? So Tarun, you first, and then Dr. Shah, to you.
I would need the microphone. So, and this is also actually linking in the question from Sri Lanka, I think, and I would say the most important is making, you know, the case for having dementia as a priority and thus having a national plan. And one of the things that is important is to look at the data. And that is some of the things, you know, and we are trying very, you know, as WHO, focusing very much through Global Dementia Observatory and the absence of data. And this is a very famous quote. Very often we say there is no data, that means there is no problem and there's no action. And that's actually what is happening for dementia across many countries. And we need to change that to provide that argument. And this will be important. I mean, I can understand why in Sri Lanka, because the priorities will be communicable diseases. The priorities will be maternal and child health. Having that data will help together with that grassroots advocacy that has been touched upon. So this is how dementia can be made a public health priority. And I'm confident we can do it.
So true. Now, yes, Dr. Shah.
I think it's a very good question. I think there's two things that has been already mentioned. It is grassroots advocacy, just letting people know the extent of the problem, and not having data is one that Maldives faces as well. We have no data, and because we don't have a digital system, we don't have the registers. But this is one of our first and foremost important thing that we're going to be doing, just having the register so you know the extent of the problem.
And we were talking about registries just now. Now, I know we got more questions online, but can I ask the room? Yes, a lady there, just you. Yes, you.
I hope you can hear me. Okay.
Tell us who you are as well.
I'm Auburnet Roll, and I'm from the Bahamas. And I was very fascinated, Minister from Malta, because it almost felt as if you were in my country. I have just under 400,000 in population, and our islands are many, 700. And it's an archipelagic nation surrounded with water. And so we face difficulties too in terms of equitable healthcare. And as I listen at data, I'm wondering, because we still paper system as well, no digitization, or minimal, I should say. In moving forward though, do you think in terms of strengthening our data when patients present to us, for example, in the history and physical, to list those symptomatologies that can sort of lead you in the direction to either rule out or rule in whether the patient may be experiencing either early onset or really has Alzheimer's, is important in moving forward and in collecting data.
Yes, it is. As Peggy said, there are various stages to the disorder, to the condition. And as we've been stressing, research is of utmost importance. It's useless. We estimate that 7,000 persons in Malta suffer with the condition. But we're not sure. That's an estimate. We estimate that it will rise because other countries are estimating the same. But what is important is, I think, that in every country, we have to make sure that this is an attractive specialty. We need young people to see it as a career, a challenging career. We want them to study, to research it. When we have data as power, we need the data to move this forward. Without digitalization, I'm afraid that's going to be hard for anyone.
Thank you so much. I have the need of my microphone. Thank you so much. Now you all know the secret of the ADI webinars. Now it's come out. We all communicate by WhatsApp whilst the webinars are happening to talk about questions. There is an interesting question here from Canada, from Dr. Saskia Sivananthan, who used to be at the WHO and now is the head of research in Alzheimer Canada. And that is to Dr. Tam. In Canada's national dementia strategy, the target set for dementia research is 1% of care for dementia. That is at least 150 million annually. We talked about research earlier. How do you think Canada is doing?
In my opening remarks, that you got to start from somewhere, and it's never enough. There is financial investments, but I'm sure everyone who is advocating for more support never thinks that we are investing enough. But we also need to leverage different kinds of funding. And I think from public health, what I appreciate is in some ways spending other people's money. So I go to other departments and I go, social policies, what can you do? Or the Minister for Seniors, or others are looking at different kinds of funding, but nevertheless is important for persons living with dementia. So there may be some more innovative ways of or collaborative models. The other thing that I mentioned was community participation, community-based research, but also what I find that we tend to do, at least in the federal government, is that there are grants to from many different departments. Nobody can navigate it. And so helping people navigate the available resources and the ability to maybe pull them together will multiply, I think, the impacts. I'm sure we can always do better, but the data is very important, and showing that what the funding to date has done will be able to help get more funding.
Thank you very much. Yes, we continue to advocate ADI for 1% of all societal cost of dementia to be devoted to research. Many countries are heeding these. They're all generally high-income countries. More are joining the fray. There is always need for more research funding. Our research report back in 2018 established that for every 12 study on cancer, there's only one on neurocognitive disorders. So there is a massive gap that we have to fill. And there are some people in this room that are trying very actively to increase the amount of research funding. Now, I think at this point, we are about to close the procedures. There's one last question. Does it have to be only the Ministry of Health which takes the lead for a national dementia plan, or can we approach Ministry of Social Security and Welfare of the Elderly to lead this? So I will take that very quickly. You can approach whichever ministry will listen to you. And most crucially and critically, as our minister will tell us, ministers sometimes our political appointment may move. It's very important that you don't only approach the minister, but also make friends with someone who is a technical expert that understands and that is likely to stay there for longer. Because they are going to probably become your best ally. And if they have a personal experience, then they will definitely be willing to help, because there is so many people in this world that really want to help. We have to find them. So on that note, I would like to thank all of my panelists, Birgitta Martenson, Iriga Shevchenkos, Minister Abela, Minister Shah, Dr. Tam, and the wonderful Tarun Dua, for being with me on yet another wonderful panel. The report is behind you for those that are in the room, and you can read it at leisure. It weighs a ton and is the first printed report we have in ages. So it's a big thing for us. And I thank you very much for being such an attentive audience. I'm sorry we couldn't take all the questions, but I thank you for being so patient. For those of you who are in the room, we're going to have a reception. So please feel welcome to ask more questions to panelists. To the panelists, I have to say, stay here because we are doing a picture just after the online connection finishes. Thank you very much, everyone.